Good morning. I cannot begin to express on how much this has meant to me personally. The individual regard of my colleagues, patients and their families, and trainees is enough reward for what I do as a clinician. Being recognized by the Miller-Coulson Academy today is the highest compliment of my knowledge and skills that could ever be granted to me. And I thank the Miller family for establishing this academy for recognizing clinical excellence. I could not achieve my vision if not for the people that support me every day, and I wish to thank them all on this day. I thank all my family members for their understanding, support, and cooperation. My teachers, many of whom are excellent clinicians themselves. Dr. Spector, who has provided me with the opportunity to train and practice at Hopkins. My colleagues for their support. The nurses and secretaries who do all the paperwork. And the many wonderful people who have given me opportunities to take care of their medical needs. When I was asked to talk at this meeting, it was natural for me to think about patient care. I consider being clinician an extraordinary blessing, one in which we are given opportunity to touch lives in ways in which many people are never able to do. I feel privileged to be allowed special access to their lives and appreciate their life stories. Perhaps what was clinical excellence was brought home to me last Christmas when I was taking care of Mr. Orr for evaluating his worsening renal failure. So Mr. Orr is in his 70s and has venous granulomatosis, and I've taken care of his renal disease for several years. On December 23rd last year, I performed a renal biopsy to evaluate his worsening renal function. And I was notified that night that he had acute necrotizing autoimmune glomerulonephritis. I knew what I had to do to treat his renal failure, admit him to the hospital and give him IV steroids and begin Cytoxan. What I also knew about Mr. Orr is that he has 4 children, 9 grandchildren, 2 great-grandchildren, and had recently lost his sister. So to me, having Mr. Orr celebrate Christmas with his family was equally important as trying to save his kidneys. So I had discussed the treatment plan with Mr. Orr and his daughter Sandy, who is in the audience today, and they were willing to get admitted to the hospital. I did not stop there. I wanted to explore some outpatient options. I knew that the infusion center was closed on the Christmas weekend. So I called the attending physician in the fast track in the emergency room and explained the situation and asked if it was possible for Mr. Orr to come as an outpatient and get his steroids every day and get his labs drawn. He agreed. So Mr. Orr was able to get his renal condition treated as an outpatient and was able to celebrate Christmas with his family. When I saw Mr. Orr in follow-up a week later, he said, "Doctor, I wanted to thank you for 3 things. For understanding me as a person and trying your best to help me celebrate Christmas with my family. For trying to save my kidneys. And for communicating daily progress with me and my family. My mission is to use my clinical knowledge and communication skills to view my patient not as a diagnosis or a problem to be solved, but as an individual in need." Next, I'd like to introduce Mr. William Guy, who, after hearing that I was being inducted today, insisted that he was going to come from North Carolina. So I'm happy that Mr. and Mrs. Guy are with us today. Mr. Guy will now speak a few words to share his experience from a patient's perspective.
In February 2006, my wife and I took a trip by train to Charleston, South Carolina. I didn't really feel like it, and actually I wasn't even hungry, and if you can't eat low-country food, then you're probably sick. So I didn't really eat. When we came back, she encouraged me to get blood work done, and 5 or 10 minutes after 5 that day, I was in the emergency room going into the High Point Hospital because of high potassium, which led to kidney failure, which led to 66 days in the hospital in the 7 months prior to a friend who's part of our family who's also a doctor making me an appointment in the vasculitis center here because he knew about this place. Unfortunately, he doesn't know Dr. Geetha. The first time she came, and Dr. Wright was probably the first one I saw in the emergency room, but then when Dr. Geetha walked into my room, and if you can imagine as being a patient with all the activity going on and you don't really know, and you've been in and out of the hospital so much, what you really need more than medicine is a calm, caring person to come and take your hand and make you feel, without saying a word, you know what, I'm going to be okay. That's what she did. And there are two major things that I think she did that are so critical as a patient. Number one was she made me feel as if I were a partner in what this whole process was about. So she incorporated me in a caring and inspiring way to be a partner with her in this wellness process. And secondly, she made me take ownership for my role in this whole thing, that she can do all the work and she can do all the discovery and she can make all the suggestions, but if I don't follow, then I'm not doing my part in the whole thing. So I think what I would like to say in closing is that I couldn't have had a better, more caring, more inspiring. She fits all your criteria, so I'm not surprised she's here. But she is the best link between discovery and wellness that this patient has ever had, and I thank her for that, and you for me being here.
So ladies and gentlemen, I'm honored and privileged to be here. Thank you all again.